Welcome back. From a quick reversal on Milwaukee Public Schools mask policy to the federal transportation mask mandate being overturned, there are several changes we're following when it comes to the COVID pandemic.
And here to help us understand the impact of these changes is Dr. Jeff Pothof with UW Health. Doctor, of course, we appreciate you being with us this afternoon. I want to start by asking you about Vice President Kamala Harris, who just tested positive. That is breaking news we are following this hour. But doctor, the White House says that she is asymptomatic. So the question for you is that more common with this variant that we have now? And are you seeing less severe cases in the hospital?
Yeah, I think a couple things there. So certainly someone like Vice President Harris, who's immunized and boosted, compared to infections with Omicron, they typically do pretty well. Asymptomatic or mild disease is pretty common in those folks who have elected to get that kind of protection. In the hospital, we see less cases, and we know that both the original BA1 and BA2 variants of Omicron cause less severe disease. But at the same time, if you're unlucky enough to get severe disease, it can be just as severe as the most severe cases that we've seen. So it's kind of like a threshold issue there. But with the level of protection Vice President Harris has, she should do pretty well with her Omicron infection.
And we'll be watching that closely. I want to shift now to Milwaukee Public Schools. Last week, they eliminated their mask mandate, then quickly reinstated it the very next day after looking at case numbers in the district. Curious if you think that move was warranted and when you think it might be safe for kids to get rid of a mask in the classroom.
Hard to know for sure if it's warranted without access to the data that they were looking at. But if they were indeed seeing an increase in cases, they probably understand how well vaccinated that school population is, how those teachers are doing. They may have decided that reinstituting that mask mandate was their best bet in ensuring that they could keep the schools open and keep the kids going so that they didn't have so many cases. Timing, obviously, I can understand the frustration around that. But, if we continue to see cases increase, they may keep that mandate in place. If we see cases ease down or if we don't see any hospitalizations resulting from these cases, you may see that mandate removed.
All right, and let's move on to the federal transportation mask mandate on public transportation. Of course, that's been big news within the last week or so. A judge recently struck it down, and now the U.S. Justice Department has appealed this. But a decision, of course, could take some time here. What is your recommendation for people who are traveling, regardless what the laws are here? Of course, a lot of people heading out, warmer weather, we think of on planes. What's your recommendation? Still masks here?
Yeah, if I was going to travel on a plane in the next couple of weeks, I probably would mask up. Not so much because I'm worried about getting severe disease. I'm vaccinated, I'm boosted, but I just don't have time to get sick. And knowing that cases are up, not knowing the makeup of who's on that plane with me, are they from high areas? Are they from low areas? I would just mask up so that I'm not sick when I get to my destination. This is kind of an experiment because if we see cases increase, but no increase in hospitalization, having the mask mandate off of aircraft won't be a big deal. But if we do see hospitalizations start to increase, we're going to look over our shoulder and say, wow, I really wish we would have kept that mandate in place a little bit longer until we understood how BA2 was going to perform.
Yeah, I was just on a plane over the weekend and over 50% of the people on board were wearing a mask. Very interesting. Okay, thank you for your time and your insight this afternoon, Dr. Pothof. We appreciate it. You can always find the latest information and recommendations on the pandemic at tmj4.com/coronavirus.